My name is Ray Richards, and I'm a radiation oncologist. I've been here in St. George for over 25 years. I was born in New York City, and I'm a little apologetic about that. I have ancestors on both sides who were in wagons that came into Utah, but my father worked for the American Cancer Society, and headquarters were in New York City at that time. Went to BYU and the University of Utah, medical school at the University of Utah, a year in Phoenix, and then a residency at Loma Linda in Southern California. They had a very exciting project called the proton beam project at that time. Really the first in the United States using proton beams for radiation therapy. And I really enjoyed my time there. I was on faculty briefly and learned about an opportunity in St. George. The day I came, I arrived in the evening. It was already dark, and back then the power used to fail all the time. And as I was pulling in, I could only see two lights, and I thought, man, this is a little podunk town. But of course it was just a power failure. And interviewed here, liked the people, liked the opportunity, thought it'd be a great place to raise a family, and that was back in 1989. Been here from the beginning. I was the first full-time radiation oncologist. Before that there were two rotating doctors who would come down 2 days a week from Provo. This specific subspecialty, radiation oncology, combines a lot of nice elements. One element is the technical scientific part. I mean, it really is cutting-edge physics and other aspects of science for benefit. One of the real challenges in our work is to try to bring down very sophisticated technology and explain it to the patients in practical terms of why it makes a difference in their situation. And that's an ongoing challenge. I tend to draw a lot on exam table paper, and so I think visually they can understand it. But the goal in treatment is not just cure, but it's to cure with the least side effects. And for radiation therapy, that means being able to direct the radiation where you need it to treat the disease, or what we call subclinical or cold disease. You can't see it, but statistically you know there's a high chance it's gone to that area. And at the same time keep radiation away from sensitive structures where you're only going to cause complications or problems, and yet they're often in immediate proximity. The radioactive source is directed in little tiny tubes. The radioactive source is 0.9 millimeters in diameter. The plastic needles that we put into the body are in effect like access tunnels going into the target. We have designed the computer to control a radioactive source that goes into each one of those, and we control how long it stays to the 1/10 of a second at 2.5 millimeter increment steps. So it sounds kind of like this, tut, 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 little staccato, really quick movements. Controlling where that source is, and by virtue of the inverse square law, the intensity of the radiation diminishes by the square of the distance. You can shape or conform the radiation. Like if your target's a banana, you can produce a banana-shaped radiation field, but then beyond the banana skin, the radiation falls off very rapidly. For example, the TomoTherapy machine does a localized low-dose CT scan immediately through a target area prior to the treatment. And some areas of the body are somewhat elastic and they move, or depending upon valve function and other things, they change in their position. And we can see even a couple of millimeters shift. We accommodate that, redirecting the beam a couple of millimeters, and then immediately proceed with the treatment. The favorite parts about being a doctor, one is getting to know people in a very special kind of relationship, and they do place substantial trust in you, and I feel very heavily that responsibility to not violate that trust and confidence, and at the same time to be fully honest with them, honest and kind at the same time. Often there's a lot of success, and they're very appreciative and grateful you've changed their life in a very positive way and opened up opportunities and extended their life perhaps to enjoy a lot of great experiences. And then the interaction with patients is very positive. It's mostly on an outpatient basis. See, they come daily for treatment, often for several weeks. You get to know them very well. And then the other part, which I don't think the public widely understands, is that many of the majority of the patients are cured, and cured with very few side effects. So I get to see patients for 5 or 10 years and finally tell them, you know, I think we're just going to put you on the cured list and graduate you, and I'd love to see you whenever you'd like socially, but otherwise you can continue your follow-up with your primary care physician. The cure rate for most common cancers is very good, particularly when it's caught early. There really is no average patient, and by that I mean I've been doing this kind of work for a long time, so the technical, professional side of it is pretty familiar now and routine, but people are always new and interesting, and boy, there's such a variety of people. So maybe I can mention a few of the varieties. And probably one of my favorite varieties is the, I'll call him the good old cowboy. And sadly, that's a dying generation in southern Utah, but either they may be very successful or in professional ways, but they still have some cows they're raising on the side just to be sure they're losing a little money every year. And they're great to work with, they're straightforward, they're philosophical about life and challenges and the outcome. I've had some great friendships with some special cowboys over the years. We see a lot of people in St. George who come from the east, Chicago area, New Jersey, New York, and again I have some ties to people from those areas, and they come with interesting professional backgrounds, and so they're really fascinating people to visit with, their life experiences. I have had patients who were the mechanics who helped build the SR-71 Blackbird, a stealth spy plane that still has been in use till very recently. I had another patient who was the pilot of one of those. Just recently had a lady patient from back in the Duke area where I have a son at school, and she has a PhD in nursing, and she just had a fascinating career and life story. So people are always new and interesting. It's also kind of fun to deal with, can I call them, slightly grouchy people, and they have reason to be, you know, irritable, if you will. They're there because of an unpleasant reason. They've probably gone through a long, expensive medical process to get there, and they're kind of irritated and frustrated. And interestingly, if you listen to them, and you can easily agree with why they're frustrated, and if you then validate their reasons for being irritable, they actually turn out often to be real pleasant. And sometimes it's a group-wide effort in the department to work with a patient who's a little grumpy, and they end up being one of our favorites, and we love them, they love us, and you know, they give hugs and tears when they finish their treatment. I have a large family. I'm getting more and more grandchildren, so there's a lot of just pleasant time unwinding at home, interacting with all of them. We've always been a busy family and enjoyed the outdoor opportunities that St. George provides. There's hardly a hill that I can see here that we haven't walked over a dozen times. There's some mountain bike trails that we've done 500 times. We've enjoyed just about every kind of activity you can imagine. I have my old 1968 Jaguar XKE, bought when I was 17, and it's still running and licensed and insured. Take a deep breath. There's enough time to get a good information and perhaps one or two additional opinions before you make a decision that can have a lot of long-term consequences. Everything you read on the internet may not necessarily be true. It's useful to then guide you to learn more, but the benefit of seeing an experienced physician is he can provide the context and the experience to put all the information in a direct fashion as it may relate to you and whether it's appropriate or not. And ultimately, communication is the primary thing we really do. So I understand their needs, the problems they may be having, their expectations, and could address them.
Gamma West, taking cancer personally.